My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California, and want to welcome you to this evening's webinar, Got Diagnosis, Women with Bleeding Disorders, which is part of our Public Policy and Advocacy webinar series. In my experience, both personally as well as collecting stories from people, I think that one of the biggest barriers that women face is difficulty getting referred to the proper expert who can really investigate the symptoms that they're having and help them determine a proper diagnosis, right? So insurance challenges is a big barrier. And feel free, like if you have experienced this, would love to have you pop in the chat with some of the barriers that folks have faced in their own personal journey. Again, if you feel comfortable sharing. But it can be very difficult to get a referral. Briefly, I will share a personal story. So my father had hemophilia B. So I had obviously definitely carried the gene as the daughter of someone with hemophilia. And when my daughter was born, I wanted to get her testing and I wanted to figure out if she had gotten the gene from me. But when I tried to get a referral to the Hemophilia Treatment Center for my daughter, the insurance company would not refer her to the Hemophilia Treatment Center. They would only refer her to a hematologist that was in their network. And that hematologist, because I investigated kind of, what their experience and background was, they were primarily working with leukemia patients, and they only had one pair of twin boys with mild hemophilia in their entire practice. So they had very little experience. I had to find a different route in order to get my daughter tested. And that was back during the time, thankfully, that My Life, Our Future was still opened, and I was able to find a way to get her tested through My Life, Our Future. But again, it takes, unfortunately, sometimes really some persistence and exploration of different routes in order to get to a place where you're going to have that proper expertise and get the correct testing ordered. Not these quotes directly, but this is a point that I just learned in the HFA seminar that I mentioned with Dr. Jill Johnson. And this is, I think, a really important point as it relates to access to treatment that she raised. So we use and have historically used in bleeding disorders this term carrier a lot, right? We've said women are carriers. And then we even at some point started to adopt the term symptomatic carrier. Well, the issue with that is that in medical genetics, so in anyone sort of working in the medical field, but potentially outside of, not super familiar with the bleeding disorders community, by definition, the term carrier means someone who has the gene, but is not affected by the disorder, right? So you see the quote from My Health Alberta: a carrier is a person who can pass an inherited genetic disease to their children, but does not have the disorder. So when we submit requests for testing, when we ask for referrals and we use the term carrier, the medical person that is reviewing that, or the claim person that is reviewing that, they are seeing a term that makes them automatically think this person is not impacted by the disorder, and therefore, why should they need this testing? Why should they need this referral? And so it's something that we really need to think about changing our language, right? So we need to describe patients as having a family history of bleeding disorders. We need to document the related symptoms and request testing and referral to be, in order to confirm the diagnosis. And so this is an important thing that it's sort of a simple thing, but it's a very important thing that we really need to change our language and be sure that providers update their language in our medical charts and our insurance paperwork to make sure that that simple language change isn't part of what is creating a barrier for us to get access to treatment and to diagnosis, or I should say diagnosis first and then treatment. So some other general tips as we think about what you can do to advocate for yourself, and we're going to talk about this in a little bit more detail with some examples and also open up for some discussion, but document everything, right? So it's really important that you document, log your symptoms, document with photos where it's appropriate and helpful, because those are going to go a long way to helping you advocate for yourself and helping the doctors really understand what you're bringing to them. And like I said before, sometimes it really does take persistence.
All right. Well, thank you everyone for joining us tonight. Please feel free again to use the email or the phone number to reach out to us if we can assist you. Thank you for coming tonight.